About 14 months ago, I dislocated my jaw. I had no idea how. Just one day it popped out. And I was in a lot of pain and decided that I couldn't really survive. I also couldn't eat because my teeth were not hitting each other. The upper and the lower didn't meet any longer. And so it was a kind of a desperate situation. I immediately called a dentist that I had been going to and discussed the treatment with him and felt that it was quite detailed and maybe painful. So I had heard about Dr. Haduong from a friend and decided that I would check into his method. And I met with him and he very carefully explained how he treats TMJ. So instead of having my jaw wired shut for 6 months and only being able to eat liquids, with Dr. Haduong's method, I was able to pretty much resume normal life, eating and speaking and not being in pain very quickly. One of the things that I mentioned to him when I first came was that I had been suffering from headaches, not severe, but sort of low, dull, continual headaches for over 5 months. And he uses a very interesting process called cranial repositioning. And so he said that this actually affects the entire jaw, and that because I evidently was a jaw clencher while under stress, that this process not only dislocated my jaw but also repositioned my cranium. And I thought, gosh, for someone my age, I thought my skull was pretty much, unmovable, but found out that much like newborn babies, it was still had some plates that could be moved around. So the most amazing thing happened. I came in for the first TMJ treatment on my jaw, and after taking a series of very detailed x-rays and looking at my posture to see how I was holding my head and how my shoulders were, he worked on my skull. And when I arrived in the office, I had my normal 5-month headache, but when I left the office, I was completely headache-free. And that was such a surprise because I didn't come to Dr. Haduong to treat my headache, I came for my jaw. And so understanding the whole relationship between how the skull and the jaw and actually the tongue influence our posture and therefore the health of our teeth was really an awakening for me. We started off with treatment on my teeth of wearing he calls a mora, which basically was on the lower teeth where the jaw had kind of popped out over here on the right side of my face. And just learning how to do some exercises with a mouthpiece that you insert when you're at a point either driving or perhaps watching television and your head is steady and your eyes are looking straight ahead. And the exercises are to learn how to swallow with your tongue touching the roof of your mouth. And this actually helps not only with your posture, but with pulling the jaw back into position. So these were all very kind of strange and unusual practices, but now after 14 months, about 3 months into the process, we put braces on my upper teeth, which would basically pull my jaw back and help position the teeth so that I could chew better. And I wore the braces for about 9 months and took them off, and now I'm wearing retainers for the next 2 or 3 months, in the day and in the night. And at night, since the beginning of the treatment 14 months ago, I've been wearing a mouth guard so that I don't grind my jaw anymore. But essentially, I feel that I have completely regained the use of my jaw. I can yawn very widely, I can smile broadly, I can do anything that I did before I dislocated my jaw. So the treatment has been incredibly effective. Hopefully I avoided having to put veneers on my teeth to raise the level of the teeth so that they would match more. Well, that's not astronomical in cost. It's a little more expensive than the treatment for TMJ using braces and retainers. So essentially, I'm very satisfied from the treatment, but I think the thing that I will always remember and hold very dear is the staff. Dr. Haduong is an amazingly compassionate and friendly and extremely patient medical professional. Because I'm a lot older than many of his patients, he does specialize in TMJ, and so for that he gets older people, but his main practice is with braces. And so he has lots of little kids who can come in and learn very quickly how to do things differently. So for me, it was a little harder to learn the swallowing technique, and sometimes I didn't do it right, but Dr. Haduong was always patient. So I will be forever grateful to the staff. He has some wonderful assistants, and just feel so happy that I had the opportunity to try a treatment that not only fixed my teeth, but improved my posture and my overall well-being and health.